820-5437 if you need it. And I do have cards, so if anybody wants to come up afterwards, the number is on there. But that's our job. We go out, and once you make that report, it goes through centralized intake, which is in Helena. They have a decision tree that they go through that decides, they kind of go through and say, is there immediate danger to this child right now? Do we need to send somebody immediately? Is it something that can be assessed within the next couple days? Or is it something, a lot of our educational neglects, kids not going to school, things like that, are screened as 10-day responses. So a lot of times we've got differing levels of response time. Reporter information is confidential. We are not allowed to say who the reporter is. Families do jump to their own conclusions. If the only place that kid has been that day is school, they're going to go to the school. They're going to yell at the school. They might yell at the school. They might say, we know you reported it. They told us you reported it. We didn't tell them. We're not allowed to tell them. We're not allowed to confirm or anything like that. The only person they've seen is their counselor. If the only person they've seen is their probation officer that day, they're going to say they know exactly where it came from. The funny thing is sometimes you'll go out there and they'll say, I know it was this person, and it wasn't. Well, then the workers will say, well, why would that person be concerned about you? Opens up a whole nother level of what that assessment is going to look like. And the other thing is, too, is I know that a lot of you guys are bound by HIPAA obligations. Statute actually protects you from that. Once you make that report, if you have reasonable cause to suspect that there is abuse or neglect, and you make that report, you can talk with us. We will try to get releases of information and stuff like that, but you can talk with us because you are the reporter for that. The workers, our policy dictates that when we get a report, we call the reporter, see if there's any more information that they have, make sure that centralized intake had taken down all of the information correctly, see if anything else had happened since that time that you made that report that we should know about, and that sort of thing. And if you can have as much information as you possibly can, if you can't, that's fine. We get quite a few unknown reports that are like, I know it's at this address, or I know it's in this area, and sometimes it can be a first name, and I've done this for long enough that I can be like, oh, I know that family, I know who that is, type thing. But if you can get as much information as you can, that's always helpful, but if not, we can definitely, do our best to get to the bottom of that also. What happens when you call in a report is it goes through centralized intake, as I talked about, and they screen it. So it can go through about 3 different levels of classifications. So the first level is an informational report. Some of our reports don't exactly have crossed the threshold, is what we call it, for an investigation. However, it still stays in our system. So when the worker looks at history, which is another thing that they have to assess, they can see that, oh, this professional had this exact same concerns 3 weeks ago. We just didn't investigate it at that time. So it does stay in our system. So those informational reports, even if they're not screened as having enough information to warrant an investigation at that time, it still is in our system. The other kind that it can be is a CFS, we call it, which is a request for services, which are a lot of our sexual abuse when it comes to child on child, or in school, teenager on teenager, that sort of thing. And Renee will talk a little bit more about our Child Evaluation Center and how we go through that. But or if a parent just needs help, if they need to be accessed, need to access services, need to be directed to services, things like that. So those are our requests for services. And then we have our CPS reports, which are our actual investigations. And so I described how they can go into different 24-hour response, 72-hour response, or 10-day responses. And we complete a full assessment on the family when we get those investigations. We have to go into what's the story behind whatever the maltreatment might be. We don't look at the incident. We do get the story behind the incident, but we look at how that overall impacts the family. And, there might be a domestic violence incident or something like that, but it's the first time that it's happened. There was no injuries, that sort of thing. And then we look at the whole picture of what that looks like. child may have some sort of injury. What does that look like in the whole grand scheme of things? And then we work on implementing services to those families if we can, in order to prevent removal or prevent some sort of further intervention by the department. We also assess the history of the family. Has this happened a whole bunch of times? Has this, do they not have history with us? We assess the vulnerability of each child. As we know, a teenager who is in the home with parents who may be using meth or who may be violent is going to be a whole lot less vulnerable. That doesn't mean that they're not vulnerable, but they're going to be less vulnerable than a 1 or a 2-year-old in the home. Dirty house, same thing. A 15 or 16-year-old in that dirty house is going to be less vulnerable than a 2-year-old who's crawling around in it. So we assess the vulnerability of the children and also the indicators for the family, which might be the mental health, the substance abuse, all of that kind of stuff. And how does that, we know that mental health or substance abuse doesn't cause, or residential or financial instability doesn't cause abuse or neglect, but those families that have a higher risk of that have a higher risk of abuse or neglect within their home. Doesn't mean one causes the other, it just means that that's something that we take into consideration when we're doing that. And then every decision throughout the assessment is made with a supervisor. Workers have to go out or they have to consult with a supervisor, which the majority of the time on the reports is me. They have to let me know within 24 hours of seeing the family. We have to staff that. We have to staff at least every week on reports, and we have to staff any decision points, as well as I'm the one that closes reports. So I'm usually pretty familiar with the reports that are coming in and what my workers have done. When we staff, we talk about tasks that need to be done and that sort of thing. If you have any questions, a lot of people are like, why was that screened informational? Why was that not screened this way? Or why did nobody go out on this? You can call me at the office down there. I can kind of go through. I do have the ability to change reports if needed. If, maybe centralized intake didn't have this piece of information and that's why it was screened this way, or that sort of thing, I can definitely kind of talk you through. Sometimes I agree with the assessment and I can talk you through what that looked like and why, that decision was made and that sort of thing too. And so the main point in the whole thing is if you have any concerns whatsoever, or if you want any specifics or anything like that, just call it in. I know that, sometimes you're like, should I, or maybe I'll give them the benefit of the doubt, maybe, that sort of thing. It's our jobs to go out and, you might meet with this child, but it's our job to go out and talk to the family, talk to the neighbors, talk to the school, talk to whoever else is working through it, and come up with a conclusion for those kiddos. We do in all, a lot of people, well, they'd just be better off somewhere else. But what we know is that over 85% of kids who we remove from a parent, once they turn 18, go back to that family dynamic. And knowing that about it, it's a whole lot easier to try to prepare them for whatever they may be encountering by going back with their family than just removing them from that situation. So trying to come up with any services or anything like that, we're going to try and, if we do have to remove, we're going to try and put them with somebody that they're familiar with. We're going to try to keep those parents involved, that other family involved. And if we do get to some sort of termination of parental rights or something like that, that's always our last resort. So when in doubt, call and we can definitely talk about it. And I know we don't always make decisions that make people happy, and we're used to that. We're always gonna make somebody mad when we're making our decisions, but hopefully we can all work together to make sure that we're assisting these families and decreasing the amount of trauma to the kids and the families. So I'm gonna let Renee talk a little bit about what happens when we have some sexual and physical abuse and through our child evaluation center and stuff like that.
Hello, everyone. My background is in teaching, so I have been accused by my own children of having a teacher's voice. So I'm assuming you can all hear me okay. If not, just kind of indicate that you can't. My name's Renee. I am the family victim advocate at the Child Evaluation Center here in Butte, and you all go like, oh, I wondered who you were. No, you probably haven't even heard of us, but usually the response is, I had no idea you guys existed. I'm so glad you do. And that's how people get to know who we are. We are a small little staff of 3 people, Jamie, Sarah, and myself. And we cover child abuse reports from all of Southwest Montana, including Dillon, Anaconda, but also Whitehall and Phillipsburg, sometimes up by Boulder, just kind of everywhere. And we would never turn somebody down, no matter where they came from. All child evaluation centers also interact with each other. So if there's a child from Billings that has been placed in our area, we do interviews as courtesy and vice versa. So a child evaluation center is a place where children come once it's been suspected that they've been exposed to some sort of abuse or neglect, and they go through a forensic interview. First of all, the Butte Child Evaluation Center, we're located down at the Community Health Building, back in a little corner, our own little door, and we have an open door, though. We'd love to have people come and see us. We know that that's the way you'll remember who we are. But we are the very first child evaluation center in Montana. You might think it would have been one of the larger hubs in Montana, but there was a core group of people back in the late 90s that really felt like this was important and established the first child evaluation center in Montana. So that was in 1997. And then they since then became the first to be an accredited center, nationally accredited center. So we're very proud of that. And we've come kind of a long way from the beginning, the formation of that. Mostly we are funded through grants, but plus also we're under the umbrella of the Southwest Montana Community Health Center. So a child has been suspected of some sort of maltreatment, and we get a call or a referral from either CPS or law enforcement. And they ask us if we could schedule for them an interview with the child. So what that means is we will have, our center is child friendly. It looks like child therapy, because we are directly associated with that also. We make it as pain-free as possible, because we know every family that we are seeing is in trauma at the time, and so we treat it like as such. Kids that come in, we have 100% believability in kids. It's not our place to say otherwise. If a child is making an allegation, we believe them. We treat them like that, and we move forward. It's no matter if it's true or not, that's really not our concern at the moment. It's really just getting that child in to hear what they have to say. So the child comes in, I meet with the family as the advocate and the child, explain to them what's going to happen. Law enforcement comes, and so does a representative of CPS. They are in a separate room, and they are there to observe the interview, but they don't interact ahead of time with the family or the child. They are there to be able to give some feedback if they feel like in the interview there might be a detail or something evidentiary that the interviewer might be able to get a little deeper on. That's what they're there for. And then afterwards, there's an option of talking with the family, letting them know kind of where things will go from there. The families almost always want to talk to law enforcement. They want to know, is something going to be done today, or what's going to be done today? And so that's kind of hashed out afterwards. So the child being forensic interviewed that means it's going to be evidence in a possible criminal action. And so these are not just people that are interviewers go through an extensive training to be able to interview children. It's different than if the law enforcement was going to interview them. And they use very open-ended questions. There's a couple of interviewers here in the room who have been through that training and have conducted lots of interviews for us, and any one of them would be able to explain that to you a little better. The thing is, though, that they're not being interrogated. They're being asked, what happened? Tell me more about that. They're not asking direct questions. Nothing can be leading. It's very specific because we know that might be viewed as the child's almost like testimony in the court case. So from there, the only other person who would be seeing that interview would be possibly a county attorney who's making a decision on how to go forward with charges. So yes, it's very we're very well prepared to do that, and kids don't feel intimidated by that process. So what else? Oh, we are part of an MDT, which is a multidisciplinary team. So that includes law enforcement and county attorneys, local therapists. It includes the hospital liaison. It might include, obviously, CPS, juvenile probation. And once a month, we meet together to talk about our most current or active cases and kind of make sure each piece has been addressed or what the needs of the family are at that time. My role in that is I can tell them if the child is actively in therapy or not, if the family has reached out to me to ask for certain help, so that I can alert the rest of the team then on what's needed in that particular case. Our MDT, we're so fortunate because after meeting with people in Montana, but also regionally, we are very lucky because we have a very supportive team. There are communities, you'd be surprised that like law enforcement just doesn't want to be interested or involved, or they want the least amount of involvement as possible. And you're like, how does that work? I mean, we're so fortunate that they'll talk with us any day. We can call there all the time. Same with our CPS and everybody. We also are very fortunate that we work right with the therapists through Community Health Center, and because they're all trauma-based for children. And I mean, we've had times when a child is so upset after being interviewed and having to tell their story that we have them talk with a therapist before they even leave. Lots of other centers they just have a therapist they hope they're going to, but we can track it and make sure they are going, or the parents are going to counseling. Those are all things that we really encourage and offer to them. So, do we want to go into some statistics, or do we want to? Sure. So the other thing that we offer besides the interview are medical exams. And actually, medical exams can be offered to anyone that we see, but it's usually reserved to the kids that have really obvious um, bruising, um, almost all sexual assault victims. We do a range of an exam on from just really a well child exam to a full-on kit or rape kit that they used to be called. Um, we check in those cases, we check for STDs, we check for injury, we check for any sort of secondary infections or anything that's going on, as well as the obvious things that go on with physical abuse, with the bruises and scratches and burns and things like that. We're again fortunate because we're right there in a medical clinic. If we need to, we have options other than just ourselves there. But we do have providers who come into our little area of the clinic to then do those exams. Our records, let's talk about confidentiality a little bit. That's one of our key things there. Our records are not associated with the clinics. So a child who comes to us, even if they're a regular a patient clinic, those records are not intermingled and they can't be accessed. So their confidentiality is very important to us. We don't identify them in any other way. I actually have at our entryway the only identifying factor for kids who come to see us is a handprint that I ask them if they want to leave. Just a painted handprint on a little canvas, and they're lining the walls there at our entryway. And I always tell them these are other kids that have been here, and this is how they left their mark, and that they were brave enough to come and talk to us. And if you'd like, you can leave yours as well. And that's kind of at the end all thing, and that's the last thing before they go, so they have a little bit something to remember that was a little happier than why they walked in the door. But again, the key is that when we see a family, we know right when we answer the door that this family is in crisis in some manner. The child, sometimes they're embarrassed, sometimes they're scared, no matter what. It's not a normal day for them, and we know that. And that then is how everything is approached. So, but a couple other things that I had prepared just to kind of go back and tell you about us. In 2021, we saw, well, our number is at 189. We generally, in the last 3-4 years, have seen around 200 kids a year. And right now, to date in this year, we've seen 66. Although I've already gotten forms filled out, I'm at like number 74. So we're kind of right on track, sadly. But that people are always like, really? You see all those kids? We're like, every day we do. And we see kids that are babies that are too young to tell us anything, obviously, but we see them for either exposure to drugs in the house or physical abuse. And we see kids all the way up to 18 that have been sexually abused. We also will see adults who are have some cognitive delays, so that and I think the oldest one we saw once was a 37-year-old in a housing unit who was claiming that somebody had done something. So you have questions about the numbers, like which type of abuse or who are the offenders, that kind of thing? That that's in my commonly asked questions area. Yeah, so very good. People are always wanting to know that. Before, right when shutdown happened, they were already asking, what's that going to do? Well, of course, nobody knew. But what we found out was, obviously, and I think Shonda would say too, obviously, reporting went down because people weren't seeing kids. So reporting numbers went down. Our amount of our overall number did not change, but what we saw was, there weren't that many referrals coming in from schools and daycares and things. Our numbers stayed fairly consistent. You might think that's odd, but I think there were some other factors with that. But after things started opening up again, obviously there were more referrals coming. Again, our numbers have kind of just stayed consistent across the board. Again, there's outside factors dealing kind of with that, I think. And also we see kids in families. So, I mean, we might have seen a family group of 5 kids versus a single, so that factors into all the numbering too. But the other thing we saw with COVID that I think is probably the most alarming and sad is we saw a drop in the age of sexual assaults. We saw actually, it was pretty drastic, really. I mean, as far as numbers go. For prior to COVID, a typical sexual assault victim, probably 15, maybe occasionally 14, but 15 to 16 range. And since COVID, our sexual assaults are definitely 12 to 14-year-olds. And I think that they're unbelievably junior high level. And now I would even say 6th grade. I think there's a couple different reasons for that. I think one, there were a lot of kids in that age group who parents felt they were old enough to be home alone, and so they were, and unsupervised. And so I think that there was some bad decisions being made, probably some alcohol, some things like that, gathering alcohol, young kids. The other thing that we've seen a lot of, and since COVID, but I think it's something that we were kind of expecting anyway, is the internet. And the fact that they can access it, nobody's home, they're really got free reign. There's a couple of games, I bet you could name them, that their chat rooms are notorious for identifying kids who are home alone and vulnerable, and we've seen a lot of that. The other side of that coin of the whole internet is that breaks my heart, but I wish I could find an answer. Kids don't understand about not putting a photo of themselves out there. And young kids, I honestly can tell you, and this was pre-COVID, but a 3rd grade girl who argued with me about, there's nothing wrong with this. This is, I'm going to keep doing it because there's nothing wrong with it. It's me, it's my body, I'll do it if I want to do it. And she was putting videos out, photos out, And you just, I wish there was an answer. I wish I knew there was a way that we could break through that. But man, there's a lot of young people putting photos out there. I would say if you have a young person in your house or a niece or anybody, I would say, how often are you checking your phone? Because I've also had parents that say, I have all the safety apps on it. I get a ding every time this happens and that happens, and she still has naked pictures on her phone. She's either getting them or she's receiving them or sending them. And and law enforcement will tell you the same thing. It's how do you stop it and how do you make kids understand? So those were the things that I think COVID really affected. We're still seeing some. I think once that goes into those age groups, it doesn't go away. It just, So I think that's going to be the trend now. Yeah. Question.
So when children are being examined or have a forensic interview, is that charged to insurance or is that taken up by the department?
We don't charge anyone for any of that. There are like there's First Step in Missoula is a CEC or CAC. It's the same thing. And if you have a medical there, you are charged for it, and we've never charged. We've just incorporated
Actually, for the forensic interviews, if Child and Family Services has an open investigation and we ask for the interview, we do pay for it. So there is a flat fee that we pay for. It goes through our state system up in Helena that we pay for those interviews. If law enforcement requests it, or if it's a request for services like a 15-year-old on a 15-year-old or something like that, then there is no payment or anything like that. So,
but the family doesn't.
No, the family never pays any.
Yeah. So somehow it's all figured out, but yeah. And actually, if they come for a medical and we provide at the moment some preventative for STDs, some medications and stuff, they also don't. That's also absorbed somewhere else. Good questions.
These ladies are kind of being humble because one thing is so important. One of the things that do these people do is that they provide blankets. We were blessed in CCCS to have our 3 of these staff, and the lovely thing that they do is have a man coordinating those teachers for kids. So I would encourage you, if you have any school blankets that you'd like to donate, to give them to these folks for the kiddos that might be living in their house in comfort, as well as for some of the students that you can at home that you have any little backpacks or suitcases that you can donate to those kiddos to have to into that by yourself. So those are the kind of things they worry about too. So they're kind of humble, but I wanted to get that out there. If you have donations you want to do, please think about the kids.
Thank you for reminding me. That's also on my list. Those are things that we do. We used to have this nice lady who would bring us a big bag of those just knotted blankets every couple of months, and then sadly through COVID, she's no longer doing that with us. But we did have the pre-release, and some of the staff there gave us some great blankets. So yeah, if you're just looking for a hobby or something, and scrap stuff at the end of a season is great. We're not picky. We always give kids a blanket, especially if they've had a medical, because they just, obviously it's not a pleasant situation. They're very exposed is kind of how I put it. And so having a blanket to wrap up in is a nice way to send them home.
And the reason why we utilize the Child Evaluation Center as CPS and as law enforcement and all that kind of stuff is so that kids don't have to relive their trauma over and over and over again. They don't have to tell the teacher, then the teacher makes a report, then the CPS worker comes and interrogates them, then law enforcement has to talk to them. So this is all, it's recorded, and as Renee said, there's a CPS worker and law enforcement there at the interview. We're on the other side of a one-way glass. So the kids know that we're there, but they don't, see us watching them or anything like that. So it's just really to decrease the trauma in that sort of thing. And the other thing is too, is that as you guys all know, CPS has to work a whole lot faster than law enforcement when it comes to this kiddo's in danger, they need to go. Charges may happen quick, charges may happen a long ways down the road. So, CPS a lot of times is working in that really, really quick, we can request an emergency and they'll get us in as quickly as they can so that we can do some of that too. So we're all, kind of working together as a team. We've got different tracks of things that we have to do, and we all work together to communicate. And sometimes we have, pretty frank discussions about what we think the other person should be doing, and, understanding. And we have a really good team right now where, understanding that we can agree to disagree sometimes and still, be professional about it and still understand our role in everything.
Right. And I think a lot sometimes when we kind of, the team has a little tension, it's always about, we think you should have gone farther to protect or help that kid, or we think you should have gone farther. And, and everybody's got their own parameters that they have to follow. Law enforcement does, we do, they do. But that's our frustration, is it's always that we feel somebody should have done more, and we have to just come back and remember we're doing what we can. Legally, we don't want to, and especially don't want to step on over a boundary that would ruin a case. So we're pretty careful about that. So.
If you have a patient that comes in and discloses something to you at therapy, maybe instinctually to send them to the emergency room, and we're happy to always see people, but that's really not the place to send kids unless they're, actively bleeding or things like that. So what we do when they arrive in the emergency room is we contact law enforcement and CPS. So it's just one more stop for that family that can kind of cause more trauma. The ER sometimes is a crazy place. So, just kind of like when you think of that, if a patient discloses to a kid or a family, the first stop needs to be to call law enforcement, CPS, get them down to the CEC, unless, of course, they have something like emergently medically. Because our providers, we're not going to ask questions and we're not going to do a medical if it happened over the weekend, unless there's obvious injury.
Yeah, that's a great point. And I will get a call and on the cell phone that I always have, and I'll say, it's the hospital, and they'll say, we just had somebody check in here. They'll give me an age and kind of what's kind of happened, and the first thing I say is, so is there an obvious injury? Because if there's not, then they need you. Then that's when they have to step back, and then the frustration of then they're being sent home, and nothing was done, even if they were already made an appointment with us. I mean, but that's another frustration that family is dealing with.
Rightfully so.
Yeah, rightfully so. So yeah, so if you ever have an allegation, you've got to call the hotline number. But you should double do it. You should call the hotline number, and you should call dispatch and make a report, because then both those reports are coming down to the two organizations that then call us to get this interview started. The other thing, first thing we have to do when I get a call from the hospital is say which detective has been called or is on the case, because that's the person I have to talk to be sure that we're going to then be able to get that family in. So, yeah. Did you have a question?
Yeah, I was just curious if there's a specific time parameter that the interview has to happen by.
No.
We get them as quickly as we can. However, sometimes it's an immediate, oh my gosh, this kid is at school, there's bruises. We don't want them to go home with the family member until we find out exactly what happened. And so in those cases, we're getting them in as soon as possible. In other cases, it can be a matter of scheduling. This may have happened, but the family is being protective. They're not allowing them around that individual or whatever that looks like. And then we schedule it into whatever works best for them and the family. We're doing the referral and they're reaching out to the family to get that.
So because to do an interview, we have to coordinate, not only just what's happening in our little area, but the interviewer, who is usually either a therapist or somebody else that we've got close to us that's been trained. And then we have to schedule with law enforcement, we have to schedule with CPS. Then if we're doing a medical, we have to schedule with a provider and a nurse for that person. So, we do the very best we can. And if it's emergent, we will see that kid that day. However, time-wise, a sexual assault, if we can see that person within 72 hours, then the kit is valid. And that's what we want to do, is be within that window, that 72-hour window. If it's like somebody comes in and says, last Friday this happened and it's Tuesday, Wednesday, then we can say, okay, go home and get some rest. I mean, that's not something you need to do right this minute because you've already passed the time frame of DNA evidence. We'll deal with you emotionally and all of that, get what evidence we can, but yes, we've passed a window there. We get allegations that were from childhood, and they are prosecuted. So yeah.
Yes. So that being said, yes, centralized intakes reporting to law enforcement, and law enforcement is cross-reporting to CPS. In a perfect world, at some points in time, they are, not always, because of somebody getting busy. We're all human, that sort of thing. But we communicate that between each other. If we may have gotten a report that we feel centralized intake should have reported and did not, we'll send it up to the detectives. We'll fax it up so that their dispatch can start working on their side of things too. So yes, we've got quite a few checks and balances where we're talking and that sort of thing. And I think Renee was more talking about, some of those emergent issues and stuff like that, where you really want to make sure that somebody's making sure this kid is okay. It may be screened for CPS as a 72-hour response, but you want a welfare check on this kid right now, making sure that both of those concerns are made.
Yep. And we can take that specific information from either entity. So CPS can call and say, we have this kid at school. We need them seen today before we can feel like they can go home. And then we'll just get that going. And then we'll call law enforcement and say, we have this case coming in. It's just that fresh that all that hasn't happened yet. And vice versa. So one other thing I wanted to just mention quick was that one of the emerging areas that we are seeing kids in is witness to violence. That's kind of our new topic. And again, we're very lucky because there are several communities, I know Great Falls for one, whose detectives will not interview, do not want to go through this process for any domestic violence cases, unless the child is the victim. We're lucky that ours are the entirely different side of that. So if they get a response or respond to a home where there's been domestic violence, whether the children were hiding in the basement or under a bed or anywhere, or right in the living room, they we get a list of those kids and they are asking if we could interview them. Because we know, and thankfully they do too, that that was not an isolated incident. And so there's a lot of information we gain from for a stronger case if we can interview those kids that were just traumatized. And I'm saying just traumatized because we know that's the big factor. But there's a whole community out there who's like, well, he didn't hit the kid. Well, we know better. And so we're lucky that we have that. And we, every one of them is like, how about counseling? You know, and then if we have some resistance, it's how about just a couple of counseling sessions, you know? So. Anything? All right. Well, thank you very much.